Porsche Foxx Morning Show, everybody, reaching for a high of 91. It is 75 degrees right now. Sunny skies, turning out to be a beautiful day. July is Fibroid Awareness Month, and I have the number one doctor, the number one specialist when it comes to fibroids and UFEs in the studio. And you just hung out with me this past Friday at the Uptown Comedy Corner. Shout out to your beautiful wife, too.
Oh, thank you very much.
Dr. Lipman is in the building. So you have a medical center. You're the founder and also the medical director, the Atlanta Fibroid Center. July, as I just said, is Fibroid Awareness Month. And this situation seems to be very prevalent in African-American women, especially.
It is. 80% of adult African-American women have these benign tumors. So it's really important for women to know, but particularly women of color, about these benign tumors. Many women don't even know that they have them. It's the number one reason why women have heavy periods. That's oftentimes what makes them present, but they can cause pain. They can cause urinary frequency. It's just important to know your bodies and know about these benign tumors.
What are some of the other symptoms?
Well, those are the most important and the most common: heavy bleeding, pelvic pain, urinary frequency. They're in the uterus and they can press on things and cause these symptoms. And so if a woman is having any of those symptoms, it's important to go to her doctor and talk about this to see if she has fibroids. She'll be examined. They might do an ultrasound to pick up these tumors. And one of the other important information pieces this morning is to know that you don't have to have surgery for fibroids. Oftentimes, women are told you got to have an operation, particularly hysterectomy. It's the most common reason why women undergo hysterectomy, and that's just not necessary anymore. It may be how your mom or your grandmom
That's back in the day.
Back in the day,
Yeah.
we can do things much better non-surgically with a procedure called UFE, uterine fibroid embolization.
And I had one. I went to work the next day.
Yeah, it's dramatic. It's remarkable, but people have to know about it. And there are a lot of studies out there that show that most women suffering with fibroids never hear about UFE. They only hear about surgery. So part of the awareness for Fibroid Awareness Month is to know that you have options. You have these great non-surgical options. Our patients go home the same day with a Band-Aid. They recover over a few days and they're back to work within a week.
So when I had it, it was probably maybe 8 years ago. What is the procedure now? Do you go through the groin area?
You can go through the top of the right leg, the groin area, or the left wrist. But it's just a way into the body. And then once we get into each of the uterine arteries, we can knock out the fibroid blood supply from the inside, and then they soften and shrink. They go home with a Band-Aid and their uterus, importantly.
What is the address of the location for the Atlanta Fibroid Center?
We're at 3670 Highlands Parkway in Smyrna, and our office number is 770-953-2600. So anybody can call, except Clarissa. Don't want to accept her calls, but anybody else is welcome to come. Give us a shout.
What if she want the procedure? Can Clarissa come get the procedure? She might have a heavy bleeding problem.
Maybe so, but
That's funny.
Doctor, let me ask you this. Have you ever heard of oregano oil for fibroids?
I have not. But there are some natural ways to. We don't know where fibroids come from. Nobody does. But once they arrive, they grow with estrogen. And so some of the strategies used to kind of prevent the symptoms or help with the symptoms is an anti-estrogen strategy. So try to avoid red meat, chicken, and dairy.
I was just going to say the diet is important, too.
That's very important.
So important.
Increase colored fruit and vegetables because they have a chemical in them that makes them colored called flavonoids, and flavonoids block estrogen synthesis. So that's important. It's always important for your overall health, but it's important for your fibroid health, too.
Oh, well, I know of a woman that, is going through excruciating cramps, man. You don't want to wait on a natural. I mean, if there's a natural cure, but there's some women that I went to school with, women that were bent over in pain.
It's horrible. I mean, terrible pain. They can have these horrible menstrual periods. Their whole life is revolved around what time of the month is. They may wear extra padding, extra clothes. They come in the office with a bag because they just don't know when this accident's going to occur. It's just very draining on them physically. It's draining on them mentally, and it just doesn't have to be. And a lot of women are told just to have surgery, but that's not necessary. You can have this UFE and get your life back.
Dr. John C. Lipman, he is the founder and medical director of the Atlanta Fibroid Center. You can call 770-953-2600 and get more information, all right? Let's ride.